Howdy everyone, Matt here. I thought I would do a little product review, something that we can utilize in the clinic or maybe patients can utilize at home. And today, starting right off, I am going to review the Advon Tens unit. I had some of these sent to me. I've tried them out. I'm going to give a breakdown of how to use it, some features of it, and along with what I would say about it. Show you how to use it. So you've probably done one in the past, but if you haven't, it does have the power button on the side, so that turns it right on. It's got 24 different modes on here, so you can look through the instruction booklet to set that up, and about 40 intensity levels on it, so you can just adjust it to however that you want. So I'm just going to set it up. So I'll put it on the first channel in here, hook it up to here to the pads that it comes with. So just really nice and easy. So you just put that right in through there. And I'm just going to go right here on my forearm. So I just kind of hit that big muscle. I'm just demonstrating. This is usually how I show people how it works. So hook it up on through there. It is ready to go. And then you just turn up the intensity there. So you just get it to where, there we go. We get it where it's pretty nice and comfortable for someone. And then that's all you got to do. Just have it set. Let her go. It goes there for however long, you know, it's good. It's just a nice, comfortable little tense. Like I said, it's not sharp or anything. I get that little tingle feeling that's going on in there that's pretty common. That is pretty comfortable. So I got it set on there. And of course I let people know numbers on it don't really matter. Some people try to max it out. I say, no, whatever is comfortable for you. So there you go. That is the unit. That's what it comes with, and that's how you utilize it. I want to first start out with my beliefs on electrical stim or TENS. I have found that it can be something that really benefits people in controlling their pain. So that there's people I typically recommend it for. If somebody brings it to me, I'm going to say, yeah, if you're in some of these cases, you could possibly benefit from it. So say somebody has a lot of pain after an injury or a surgery. Those people can benefit from it. Maybe somebody who's dealing with a chronic pain that has episodic flare-ups, they can really benefit from it. It also could be someone who can't take a lot of pain medications due to having a reaction of some sort to them. It upsets their stomach, just does something to them, and they're like, I can't take this medication because it affects me. So this is a way that they can control the pain. Also, I've utilized it for people who have flare-ups from time to time, so maybe they're not able to come in and see me over a period of time for something, but they're saying, hey, I'm trying to go back to do X, Y, or Z. They can use this to help kind of modulate and control that pain after doing something. Also a big one is if somebody's trying to go back to work. So if somebody wants to go back to work and they cannot take a pain medication because if they're on a pain medication, they're under the influence of something, so it's not, they can't do it. They can use a TENS unit to modulate their pain, to control the pain when they take their breaks, things like that. Or if maybe their pain medication is wearing off pretty quickly, so saying that they can only take this medication every 4 to 6 hours and it wears off after 2, well, rather than just suffering for that period of time, they can use the TENS unit between that time to control their pain. So what do I think about this TENS unit? Well, I will say the accessibility is very good. You can get them on Amazon. I'll have a link below for them. So an easy place to get them. It is very cost effective, less than $40. I like that. When you can get a good quality one for a cheaper price, that just makes it easier for people to have access to. I also like the fact that it can recharge. You're not dealing with batteries that you're trying to replace and things like that. So when between times of using it or maybe overnight, just recharging it. So for ease of use, it is pretty self-explanatory to use. You do have the guide there. Also, I ask patients if you get one, bring it in. We'll talk about it as well just to kind of help you get a better one. But you can slap it on the area, turn it on, crank it up to what feels comfortable, and just let it go, and it's going to run, and it does very well. And I will also say it's pretty comfortable. I utilized it on myself. It is comfortable, and it also has a good amount of power to it as well. I did crank it up a little bit before. It does have a good amount of power to it, so I like that about it. So things I don't know about it is the long-term durability of it, but I will say at that price point it can be easily replaceable if it wears out. Additionally, wires and things, they can wear out over time. You just want to be careful of not, when you take off the leads, that you don't want to pull too much on the cords here as well. Also be careful, you don't want them wrapped around stuff, it can fray the cords, but these can be replaced pretty easily. As for the pads, these look like pretty standard pads, so they are going to last about the normal amount of time with pads. I will say, let you know about pads, you want to make sure that your skin is clean. If you're hairy, if you use it on an area with a lot of body hair, it may not stick as well and it may wear the pads out a little bit sooner. Also, if you have more oily skin, it may wear them down a little bit more. So you don't want to be sweaty, you don't want to put lotions or anything on beforehand because that will wear down the pad. You can often get a little bit longer use out of pads. If they kind of start losing their stickiness, you can clean them with an alcohol pad and that will give you a little bit more life out of them. What do I feel about this product? I do feel that it's something that could help patients. And if somebody came to me to say, Matt, I'm dealing with this pain, do you think I need a TENS unit to help me? And we go through all that stuff I spoke about earlier, I would say, hey, yeah, you can get you one of these. It can help you with the pain. Of course, keep doing your rehab, keep working with me or working with your therapist to help you get better. And this can be a very, very good way to help you control your pain, get you off of that pain medication and get you getting back to the life. So there you go. That's the Advon Tens Unit 7000. If you're interested in it, like I said, link is below. I hope you pick one out and you enjoy it as much as I do.